Thank you for joining us. Today I'm joined by Mr. Shanawaz Rashid, who is a bowel cancer surgeon, and we're going to be having a conversation about all things bowel cancer. So welcome. First question, what do we actually mean by bowel cancer?
So the bowels are the whole intestines, which go all the way really from the mouth to the bottom. But when we talk about bowel cancer, we really talk about colon and rectum cancer.
Sometimes we say colorectal cancer,
exactly,
don't we?
Exactly. So that's the large intestine. So the small intestine is the bit where you absorb the goodness of the food, and the large intestine's main job is to really absorb water, so we don't get dehydrated, but also some vitamins to keep us healthy.
Right.
So when they talk about bowel cancer, really what they mean is colorectal cancer.
Okay. And how many people does bowel cancer affect here in the UK?
Well, the numbers are increasing, but actually it's about 42,000 people per year.
Is that 42,000 people each year that
who
would be
get it, who get bowel
diagnosed?
cancer,
Right.
and then about a third of those are rectum, and the rest of them are the remainder of the colon.
Right, okay. So it's fairly common then, as far as cancers go?
Yeah, it is common. I mean, they're talking about 1 in 15 men and 1 in 18 women in the whole population. So it's, you know, one of the commoner cancers. In fact, it's the 4th commonest cancer, but it results in the 2nd largest number of deaths.
Right.
Because lung cancer is commoner and it also causes deaths, whereas prostate and breast are more common, but they don't result in deaths as frequently.
Right. And are there some people that are more at risk, more susceptible to getting bowel cancer than others?
Yeah, about a third of people have got a genetic link to it. So
Right.
they've got a relation who's got polyps or cancers, and 70% of people just get it by itself. And
Right.
although it does cause some genetic abnormality, it's not an inherited one.
Right.
On the whole.
And I think something that's important for us all to know is what are the typical signs and symptoms that we can look out for?
Yeah, the commonest ones, the commonest 2 are bleeding from the bottom and a change of bowel habit, and that normally means either more loose or more frequent. So people often think it's constipation, I'm a bit constipated, and that means I've got bowel cancer. It's actually the opposite, rather than it's actually looser and it's actually more frequent. So if that remains for a period of time, obviously we've gone out for a night out and we've had a curry the night before. We're not talking about that. We're talking about a sustained period of time where your bowels just become a little bit looser.
Okay.
And there are other symptoms. You can get bloating, you can feel abdominal pain, you can pass mucus from your bottom. But the 2 commonest things, bleeding from your bottom and a change of bowel habit towards looseness.
Okay. And how important is it to tackle these signs early? So if anybody is noticing that they're having these symptoms, how quickly should they act?
It's really, really vital. The earlier you pick up on these things, the better your outcome will be every single time. So what we know is that bowel cancer, colorectal cancer, starts off life as a polyp. So it goes from normal bowel to polyp to cancer. And there's a period of time between those different steps. So if we can pick up something at the stage where it hasn't become cancerous and it's a benign polyp, then we'll prevent the cancer happening completely. But even if it has become cancer, then the earlier you pick it up, the earlier you deal with it, the better the outcome, you know, always. So the difference between a benign polyp and a cancer is 2 things. One thing is the ability of that thing to invade deeply into where it started off life, and the second bit of it is the ability to spread elsewhere.
Right.
So those 2 features are what defines cancer.
Okay.
But the benign polyp hasn't invaded, so if you can just remove it as it is, it doesn't become cancerous. Where you get these polyps and where you get the cancers is the inner lining of the bowel wall, the very innermost lining. And that's the lining where glands are, and the glands make mucus. And so you have the change from normal to polyp, and that creates the mucus, and that makes your bowel looser on the whole. So the polyp has got the similar symptoms to the cancer.
In this country, we do have screening available for bowel cancer, which is really good news because that is another tool to help us identify changes early on. Can you tell us a little bit about the screening?
So screening is normally every 2 years for everyone in this country from the age of 60 onwards. Many people are offered it at 56 as well in most areas, and you have it every 2 years. And what that does, it's not a test for cancer, but it's a test for the presence of blood in your poo. And that's an important thing to recognise, because even if it comes back positive, the vast majority of people with a positive test doesn't mean they've got cancer. It just means there's blood in the poo. And remember, the commonest cause for blood in the poo isn't cancer, it's hemorrhoids and other things in the bottom. So although people might think, oh, I've just got hemorrhoids with bleeding, you might be right, but you want to be sure and you want to make sure that there's nothing else worse than that. And so that's why we encourage the test to happen. Now the new test, something called a FIT, which stands for fecal immunochemical test, is a really accurate way of picking up the presence of microscopic blood in the poo. So remember, when we're looking at the poo, sometimes you don't see it, it looks normal, you know. Some people look at their poo more than others, as we know, but people generally might not see anything, but the test will pick it up at a very sensitive level. If it comes above a certain level, and that number's 10, above 10, then we would want to investigate with something like a colonoscopy or something like that.
And I wonder what your thoughts are. As a GP, I sometimes will ask patients about their poo, particularly, you know, have you had a change in bowel habit? Have you noticed any blood in your stool? And often patients will say, well, I don't look at my poo, and almost seem quite embarrassed. We need to change that, don't we? Because we need to look at our poo.
I mean, generally people are quite embarrassed to talk about these things, aren't they? I mean, you know, who wants to talk about their toilet habits? Nobody does, really. And so I think to raise that awareness is really important. And particularly in younger people, I must say, something like 6% of people with colorectal cancer are under the age of 50. So I think raising that awareness in all generations is really, really important. People justify the symptoms to themselves, don't they? They say, oh, it's this, it's that, or I ate something funny, and all sorts of things that you've heard hundreds of times before, thousands of times before, as I have, that you justify it because you don't want it to be those things. So you make up something, oh, it's because I had something funny to eat, or I've got piles, or you say all these things, but actually having that awareness to say, you know what, I can't look at somebody and say you've got bowel cancer, you know, none of us can. No. So what we have to do is say, well, there's an index of suspicion, you might have it. You might not, but it's definitely worth investigating and finding out whether you do or not.
And the really important reason why is, well, if it's not bowel cancer, that's reassuring, you don't have to worry about it anymore. But if it is, finding it early means the chances of curing it essentially are so much higher than if you know, leave it for months to get worse.
Yeah, definitely. Explain to people, it's not that bad, the whole process of diagnosis, of coming to the answer. People are very scared of being examined or having tests that they might perceive to be difficult or painful. But if we can, I suppose, make them feel more at home with us as clinicians and don't feel we break down those barriers between us, I think that's really important generally, not just for bowel cancer, I think across the board.
I agree. Coming back to screening, I've actually got one of the little tests here. I thought it might be quite nice to demonstrate just how easy this is to do. So these, if you're eligible for screening, then people receive one of these in the post. And it's so simple. All you do is, when you've had a poo in the toilet, before you flush the toilet, take out this little stick, and the end of it, you just get a little bit of poo on the end of it, put it in there, flush the loo, put it in an envelope, send it off, and that's a screening test done. But it surprises me, I'm looking at statistics here, it says just over half of people, 58% in England and 56% in Wales, who receive the screening test, complete it. I look at that number and think that's very low.
Remember, people, if they haven't got symptoms, they'll think, that's not for me, I'm all right, thank you. It's only when people have symptoms, they start seeking medical advice. You're talking about people who are asymptomatic on the whole, aren't you? So people who might have blood in their poo without realising it, but they've got no change of their bowel habit, they've got no pain, they're all right. So what most people think is, if it ain't broke, don't try and fix me, I'm all right, thank you.
And I think that's an important distinction to make, isn't it? Screening tests like this are designed for people who don't have symptoms to try and pick up, in this case, any blood in the poo at such an early stage before it's even given symptoms. If people do have symptoms, don't hang around waiting for this. Go and see your doctor straight away. This is not the test.
Exactly. So if you've got bleeding and you've seen it, that trumps this, doesn't it? Because you've actually seen blood.
What are the risks then of delaying going to see a doctor in terms of, I mean, I think the nitty-gritty is survival.
Yeah. So the earlier you pick up something, the better the outcome across the board. If you pick up something in the polyp stage before it becomes cancerous, you just won't get cancer. So you'll have 100% survival. As you go further along that point, and we talk about stage, a stage means how bad it is, or how advanced it is, or how spread it is. So the further you are on your stage, the worse your outcome is going to be, and that's purely time a lot of the time. So the longer you leave it, the thing might be growing, invading, and starting to spread. So it's sort of obvious that the further you leave something, the worse it gets. And remember, bowel cancer is one of the most treatable of all cancers.
Yeah.
And it's preventable because you can pick it up before it becomes cancerous. So some cancers, they become so advanced so quickly before any symptoms come. And by the time
they're hidden inside the body and they don't, have bleeding, for example, into the poo. How is bowel cancer diagnosed?
The first thing is somebody seeking medical advice, seeing a primary care doctor, GP, and then getting referred to a specialist for further tests. And the two sort of commonest tests are a specialist kind of a CT scan called a virtual colonoscopy or a colonoscopy. The colonoscopy means a tube up the bottom which looks and can identify and remove polyps and also see potential cancers for biopsy. A CT scan can identify things bigger than about 4 or 5 millimetres, but obviously can't remove them or test them, as it were. So the gold standard is a colonoscopy, but if people really don't want a colonoscopy, they can have an alternative, which is a CT scan.
And we've spoken about how bowel cancer is actually quite common. It's the 4th most common cancer, so really we're all potentially at risk. So what can we all do to prevent or reduce our risk of getting it?
I suppose it's a healthy lifestyle, reduction of smoking, drinking less alcohol, more activity, trying to lose weight if we've put on a bit of weight, and having a general awareness that you may have bowel cancer and seeking advice early. It's the same advice I would give for anyone in general, really.
Yeah.
The only additional thing was fibre in the diet and having more fruit, vegetables. Those things are known to have a reduction in bowel cancer. There's some evidence, which is relatively weak, but red meat can increase your chance of bowel cancer. So I wouldn't have red meat every day. I mean, if you need to eat red meat, have it slightly more sparingly.
Okay. So I think that's really interesting that whilst you can't change your genetics, you can be more vigilant if you think you're at higher risk. And then there's some healthy living things that we can all do.
Absolutely.
Shanawaz, thank you so much for joining us. I hope you found that as informative, interesting and useful as I did, and we'll see you again next time.